Alice and Iba have kindly agreed to talk about migraines today. So I just think how blessed we are to have our own personal, it feels like our own personal clinicians with us. And so without much further ado, I am actually going to pass over to Alice. Thank you, Alice.
Thank you very much. You know my name. You know, I'm a big supporter, and I work with Sahara Nutrition with Dr. Hiba, and of course, Healthy Hearts, Caribbean and African Health Network. But before we carry on, do you know someone with migraines? So what is migraine? Migraine is an inherited neurological disorder. This is what they refer to it. But because we're going to talk about nutrition, I will not spend so much talking about the other things about migraines. I'm sure most people who have migraines know. So we know that migraine can cause severe throbbing pain or pulsing sensation, usually on one side of the head. So people get it in different parts of the head. I used to get a lot of migraines. It used to be always on the left side. I just hear like a pulsating pain. It just starts and I know there comes the migraine. I rarely get it now because I've done a few things, but let's learn. So when you get the migraine or the severe migraine headache, it's usually accompanied by nausea, vomiting, and extreme sensitivity to light and sound. And for some people, so many different things trigger migraines, maybe fatigue, a perfume, a certain food. But today we are going to concentrate mostly on food. And we know that migraine attacks can last for hours to days, and it can be so severe that it interferes with your daily activities. And most of the drugs that are used for treating migraines actually make you drowsy, make you very relaxed, and make you sleepy. So they are not the best if you have to work and provide for your family, if you have to go daily. What this really means that migraines is something that we have to learn how to manage, and we have to learn how to control it because it can consume us completely. It can even make some people get depressed because they cannot control their migraines. So then let's look at diet and migraines, like what are the do's and the don'ts about diet and migraines. So how does your breakfast and lunch affect your migraine? Let's start by talking about breakfast. We know that in the morning, you need to eat something before you go to work. But because of so much science, sometimes you don't even need to. When you wake up in the morning, your brain needs ready glucose for energy. So when you don't eat anything, it means your brain ends up using a stress hormone for energy. So studies have shown that when you use stress hormones for energy, so you don't eat breakfast and you take long hours without eating, at the end of the day, you'll get a headache. If you have migraine, you're going to get a migraine at the end of the day. And so studies have shown that not taking breakfast triggers migraines. Staying long hours without food triggers your migraines, okay? I said breakfast at lunch, but I actually meant breakfast and dinner. If we have a large dinner, which a lot of us tend to do, then you don't sleep properly because the food is being digested for 6 to 8, especially if there's protein or meat, the food is being digested for 7 to 8 hours. So what does that mean? 7 to 8 hours, there's digestion, it interferes with your sleep. So you don't get your full sleep, or you don't get to the level where we call the rapid eye movement. So it means that you're not well rested and you're tired. This practice carried over time actually becomes a permanent cause of fatigue and burnout, which the body ends up producing a lot of stress hormones, cortisol, insulin, and glucagon, and many other stress hormones that actually can trigger your migraine. So some of the persons I have worked with to manage their migraine, they have migraines because of just eating no breakfast and eating a large dinner. And when we change that, it actually happens. In fact, the best is always making sure that they eat breakfast. So how about hydration status and alcohol intake? So we are told to take 8 to 6 glasses of water, and there are so many reasons why we need to take water. Every second of your life, the body needs water. So this 2 liters of water, approximately, you should distribute it throughout the day, and it is utilized the whole day. So you should not take water in the morning and then wait the whole day and take water in the evening. You need to be distributing water and taking it through. So people who don't meet their water intake tend to and they actually already have this neurological disorder called migraine, they tend to get frequent attacks of migraines. Studies have shown that, and I've also seen a lot of patients who actually that is a problem. And alcohol is a diuretic, so it makes you dehydrate, it makes you lose fluid. So for people who take alcohol every day, we know if you take a glass of wine every day, it's not bad, it's healthy. But when you have migraines, this increases your dehydration status, and this increases your trigger for migraines, or you just permanently have migraines. Yes, and you can think of other things that can cause dehydration. Even some people cannot tolerate caffeine. The minute they take caffeine, they get a migraine. And also we know that caffeine is also a diuretic. It makes you lose fluid. So if you take a lot of coffee, it means that it affects your hydration status. Sometimes you end up taking 5 cups of coffee, but you think you're taking water. No, that's not water. So you've not met your water intake for the day. Sweeteners. In an effort for us to eat healthy, some people actually take sweeteners. And nothing very wrong with sweeteners, but this sweeteners, aspartame, which is sold as NutraSweet in the market, and then phenelzyme. These have been found to actually cause and trigger migraines, and we know this is part of your diet. And then, of course, also monoamine oxidase inhibitors, which are a class of medications used to treat depression. So if you're taking some anxiety medication and you have migraines, or you're taking depression medications, we need to check. You need to check that. And the most interesting that a lot of people actually don't know is a chemical called Tyramine. Tyramine is a natural substance formed from the breakdown of proteins as food ages. So it is found in aged, fermented, or spoiled foods. So when you have old food, and which are these old foods? Sometimes a high protein diet, cheeses, aged meats, curried meats, Marmite yeast extract, sauerkraut, all these things have got very high levels of tyramine. Then we have soybean products, fermented soybean products, even bean pods, and for people who take alcohol, the beer. All these things, these ones have the highest levels of tyramine. Sometimes we also buy like yogurt, which has fruits inside. That's also old food. Or you just cook fresh vegetables, you cook your fresh meat or fresh chicken, and you keep it in the fridge for days or weeks on end. It will still form some levels of tyramine. Not as high, but it will still form some levels. So it's been found that a lot of people with migraines, when you take old food with this, then it triggers your migraines. So you need to look out and watch out. Am I eating old food? Like take a stock of what you eat. In fact, keep a diary of what you eat so that you can identify this. And of course, the side effects of tyramine is very, very bad headaches. You can get palpitations. And we know already migraines is accompanied by nausea and vomiting. And what is also very dangerous, especially when you eat tyramine, which is actually found in processed foods, foods that have been packaged in tins and plastics and any other type of packaging to last long. These are very high in tyramine. And you can actually also get what we call hypertensive crisis, which means you get very, very high blood pressure, which can land you in hospital or you can get a stroke. So we have talked about migraines. What is migraines? We have talked about the things that trigger your migraine. If you skip breakfast, you're likely to get a migraine. If you take too much dinner, if that's a habit that you have, it takes a very long time. Eventually, it makes you tired and fatigued because you don't sleep properly. That will cause migraines. Something that I also mentioned is when you stay long hours without food. Some people don't take breakfast, and then maybe they have their first meal at 3 o'clock. Unless you're under some medical treatment, that is not good. You will get migraines. Then things that cause migraines also is dehydration status, which can be caused by you not meeting your water intake, taking things like alcohol, and also taking a lot of caffeine. We've also seen that some sweeteners actually trigger migraines. And then we've looked at tyramine, old food. So what do you eat? How long do you keep your food in the fridge? Do you eat a lot of the processed meats, the cured meats? So those are not good. So what is the solution? Of course, you have to make those changes. But I have this, it's called freeze. F means free of toxins. What are these toxins that you have to avoid? So if you have migraines, you should eliminate alcohol from your diet, especially if it triggers your migraines. If alcohol is your toxin, remove it. If caffeine is your toxin, remove it. If it is the sweeteners that we talked about is your toxin, remove it. If it is the old food, remove it from your diet. And then let's see what happens. So what are your toxins? Are you taking too much sugar, too much salt? You know, all the other things that includes poor dietary habits are your toxins. So be free of toxins. So that's F stands for free of toxins. And then R stands for rehydration. Most important, please always make sure you take your fluids. And then E, the first E, the second E is eat healthy. Eat healthy. And healthy eating, you know, we've discussed about it. And most importantly, eating healthy means eat a variety of foods. Eat as natural as possible. You know, I don't recommend sweeteners for my clients because I never want to increase your bill. If you take 1 cup of coffee or 2 cups of coffee and you take a teaspoon or 2 teaspoons of sugar, there is nothing wrong with that. It's okay. The only problem is when you take 4 teaspoons of sugar, 5 cups of tea a day, or 5 cups of coffee. Take 1, 2 teaspoons, 2 cups of coffee, nothing wrong with that. So taking a little sugar in your diet is fine, but remove the sweeteners. And then sometimes also when you have stress, it can also trigger migraines. So you should manage your stress. And the best way of managing stress is exercise, exercise, exercise. If you can't make time for exercise, be ready to make time for illness. That is one of the very famous sayings I like to use by Earl of Derby, right there in the UK. So last but not least, what is our parting shot for today? Taking drugs without eating properly is like washing your hands and drying them in the dirt. So if you have migraines and you find that you're frequently having to take medications to manage your migraine, in the long run, this medication is also going to be toxic. Yes, I completely agree and understand that when you get a migraine, remember, we have migraines in the family. I get migraines occasionally. I used to get them so much until I'm a dietitian. I have to apply these principles for me to help my patients. And so I applied. And for me, the one that really worked was the Tyramine. But of course, as a student, also you have bad habits, long nights, you don't sleep well. Either you're reading hard or you're out dancing the whole night or you're taking too much alcohol. And then I had them migraines like crazy. And so now if I know I'm getting a migraine, I know I've overdone it because there's always sometimes you work too late, you know, you don't meet your water intake. You know, this is life, it happens. But we just taking those drugs without eating properly is like washing your hands and drying them in the dirt. So let's make an effort. We know we have to change our lifestyle. Sounds like such a big project, but no, start slowly. What is it that you're going to do? If you don't take breakfast, start taking breakfast. If you take a large dinner, reduce it. If you don't meet your water intake, start meeting your water intake. Nowadays, we even have apps that can help you with these things. Get an app that reminds you, take your water, you know, and get an app that helps you exercise and count your step. So I leave you with that for today, and I'll take the questions. Thank you very much.
Thank you so much, Alice. As always, so informative. And as we said, it was my migraine that has, sort of initiated today's topic. And it was quite interesting because one of the things that, I used to suffer from migraines in my youth on a very regular basis. And it was always hormone. It was, it was put down to being hormone related. But actually, when I read some of the things that you've written there, I thought, probably some of the alcohol related and not drinking enough. And as a nurse, I get up early, so I've got into the bad habit of not having breakfast before I go to work. So I think back, there's probably many of those things that you identified. probably impacted on my migraines. But yeah, so thank you again for reminding us, I think, as you said, to ensure that we keep hydrated. And I always go back to that saying, taking drugs without eating properly is like washing our hands and drying them in the dirt, because we can take the medication, but if our body isn't doing what it's supposed to do, it's pointless taking the medication, you know, because we have to do something for ourselves.
And you know what, Karen, I feel you. I used to get migraines. I still do. Occasionally I do, and I know when it's coming. And then I look back, what is it that I didn't do? I used to keep records for myself, all my dietary intake, Monday to Monday, exercise, water intake. And then I was able to really learn about it and identify what triggers my migraine, the seasons that I get migraine, what it is that I'm doing. And then I've had to change my lifestyle. So I can tell you that I can get a bad migraine once in 3 months. But remember, it's an inherited neurological disorder. So when you come from a family that has that, some people will have it, some people will not have it. Just like in a family with asthma, some have it, some don't have it. But it can be controlled. And I can tell you, it can be controlled and it can be managed. Yeah.
And it's interesting that you should say it's inherited. I mean, I've got 3 siblings and 2 siblings have migraines. And, you know, one of my nephews, he also has migraines. So like you said, it's already, unfortunately, the inheritance continues. But it's not all about me. And there's a question in the box. Can you advise about migraine with aura? She's had TIAs in the past and is told that these could have been migraine with aura instead, she was told. She has no headache or any other symptoms most of the time, but does have visual loss.
Yeah. So some people have different wordings, or some people get, the migraines are different. Some people get severe headaches, nausea, vomiting. Some people get headaches, like really frontal, very, very bad headaches. And like you said, you get, I've had some people who get, they see partially. I just, it's called aura. I say vision loss. They see partially and they know that it's almost like one eye has gone semi-blind. And then they find that it's actually migraine. But it's just presents differently for different people. I get headaches, but I don't get vomiting and nausea now. I used to get that before. So I just get mostly headaches. So it's just naturally how your body wants you. So it's nothing to do with your diet and everything. So managing is the way, because you have a migraine, you manage it the same way, but the way you get it, your symptoms are different. Yes. So unless I do some research, I don't have any special advice for when you have a migraine with the vision loss. Yeah, but I know it's more of a warning before your headache comes. Yeah.
Thanks very much. Is there anything else you want to ask on that question, Samantha?
No, that's absolutely fine. I just wanted to say thank you for that, and just, I suppose you've given me a bit of insight to say that you're saying it's the same, it's just how the symptoms present for each individual person. Yes. And that you would manage it the same way by doing the things that you've mentioned, which is what I was interested in, really. I personally I only get the vision loss. I don't have any headache afterwards or beforehand. I don't have any nausea or vomiting or anything like that. It's just the vision loss. So it's interesting that you say to do some of the things, and I will try some of the things that you've mentioned. I've made some notes, and I'm going to try these actions that you've mentioned.
Okay, may I also ask Samantha, do you have blood pressure? You can choose to say.
When the first time it happened was in December. There has been times when it has been when I have had high blood pressure.
Okay, why I've asked that is I just remembered a friend of mine also had very severe migraines, but then she used to have, her migraines come with actually vision loss. She's partially blind for some time until she takes a medication, but she had very, very high blood pressure. Some people have migraines with very high blood pressure. So she had very, very high blood pressure. And it was those blood pressures of stroke levels. And she used to get, hypertensive crisis. But now she's managed to contain it. So it can be managed and it can be controlled. So thank you so much, Samantha, for sharing. I wish you all the best, and you can always reach out with questions.
Okay, thank you very much.
Yeah. Thank you again, Alice, for sharing that with us, and for I think it's that kind of commitment, really. to make a change. And I love the other saying that you said, if you can't make time for exercise, and make time for illness. And I think this is the same here, is that, you know, we have to take the time to look after ourselves and do the things that are right. I have another question in the box, and it's Lorraine said, I've had migraines since the start of puberty. She's been on every prescription drug going. She can describe her migraine as feeling like having a hangover without drinking the alcohol. The one thing that she can say that has helped her is exercise and diet. Thank you so much for sharing that, Lorraine.
Thank you for sharing. I remember taking some medications, and you're like, I feel like a Zeus the whole day. You know, you take it at night, yes, to sleep, but the whole day you're feeling like you're high, seriously. And I don't like medication, and that is what helped me to work very hard. And I can tell you, I rarely take medication for migraines. Just that one time when I misbehave, I even know, and I stop it just for occasional. But you can reduce it from taking it every day to taking once a week, and from taking it once a week to once a month, or even once in 3 months. Yes, it's hard work, but it pays off, because some of the things that happen when you take a lot of medication, it becomes poison. It's poison because your kidneys, you know, it has to be eliminated by your kidneys. If you don't meet your water intake, it damages your kidneys. Already people with high blood pressure have a risk of getting a kidney problem. So if you have migraines, your blood pressure is not controlled, the risk of kidney is high, plus the medications drive it. So it becomes a vicious circle. So let's just do what you can, get help, and let's support each other, because it can be help. I've seen an interesting question there.
Yeah, thank you. Just a quick one as well, Alice. So as I say, yeah, it's been from puberty, and it's funny because it does kind of, I mean, I wouldn't say it runs in the family, but I'm the elder out of 5 siblings, and I have migraines, and then my younger brother also has migraines. So it's weird how it kind of skips, I think, a generation, but my mum doesn't have it, my dad doesn't have it. But as I say, yeah, for me, I think the healthy eating and alleviating stress is key. But sometimes with everything going on, it's kind of hard to, get away from the stresses. But as I say, for me, the drugs that I took from the age of probably about 10, I was on all kinds of medication because they were that bad. And for me, I try not to take tablets unless I have to be very, very, very poorly to take medication. But first it was, as I say, from the age of 10, I was taking pills, and right up until probably about 18. And then I said, no, this is not good, because it was making me anxious. I was getting really bad depression. And then I was put on antidepressant tablets for the migraine. So it was just a vicious cycle for me, to be honest. But yeah, I'd definitely say diet is key for me personally.
Yeah, thank you very much. At least we have a success story right here with us. Yeah. So go people, diet and exercise. Definitely. If you have happy hormones that reduce those migraine toxins, go run, go dancing. Have you ever seen anybody who dances with a frown? Dancing is one of the best exercises. So, yep.
The next question actually leads very nicely onto how Lorraine was ending hers, about sort of, the sort of trying to reduce stress. The next question is, can migraines be linked to mental health?
Yes, it can be. So what's mental health? It's a disturbed emotional state. Let me tell you, those headaches are not good. They are bad. They are bad. Sometimes you wish that a car can run over you, you die when you're in the middle of those very bad ones. And imagine if you constantly are having these migraines. It will disturb you emotionally, and you can be depressed because you're constantly taking medications that interfere with your normal daily function, medications that make you just drowsy, medications that, make you even lose the taste for food because you're taking them all the time. Yes, it is linked. So if you're managing somebody with a mental health problem, you have to, what's the underlying cause? You always go back and assess what's the underlying problem. And you find that if they have migraines, you have to sort them. The migraine management, dietary, then you can be able to successfully deal with the mental problem. Yeah, it is linked and it can be managed also. Thank you.
I think it's really important, the point that you're saying, that how awful it makes you feel. Because that in itself, I think, unfortunately, Lorraine said, you know, she was put on antidepressants to cure the migraine. It's well known. I think it's amitriptyline is the one that was given, that used to be given, and they give a very small dose. But it's still an antidepressant, but can be used for pain relief. But the impact, as you were saying, Alice, for those medication makes you sometimes feel worse than the illness itself. You know, so it's like a vicious circle. And actually sort of trying to, you know, rather than always give the pill, as we say, you know, sometimes if we can just adjust our diets, that might just be the quicker fix for it. I'm not saying it's a quick fix, but it might be a more long-term and more effective way of dealing with those migraines.
Because it can also really impact your quality of life, and it can also reduce your life expectancy by 10 to 15 years, it's been said, if you don't manage it well. Yeah. So I think, and I like what Lorraine is saying. She's been there and beyond. It's awful. So yes, but it can be managed.
Does that answer your question? Did anything else that you'd like to ask on that?
No, I think that's good. Thank you very much.
Okay, I wish all of you the best. Please remember, taking drugs without eating properly is like washing your hands and drying them in the dirt.